around the corner, and we are counting down the days to a swimsuit-ready you. Now, are you vain about your veins? Because I kind of am. And half of us suffer from spider or varicose veins, and today we're going to show you how to make them disappear in time for summer. Please welcome the author of In Stitches, plastic surgeon Dr. Anthony Youn. Nice to see you, Anthony. Good to see you. And bravely showing off their legs are Revolution viewers Amy and Terry, and Terry is one of our participants in our swimsuit challenge. Thank you so much for being here. Now, Anthony, we're so thrilled that you're going to show us really how to take care of the vein problems in our legs. But before you get started, this is an embarrassing war wound I have from a lot of hours on my feet and 2 pregnancies. Bad, huh?
So normally you call these spider veins, but for you, I'd say these are more like daddy long legs type veins, or even tarantula veins.
Yeah.
But very common.
They're not so pretty. Now, Terry, you have spider veins also,
yes,
and we're going to take a look at them in a little bit. But first, Amy, can we take a closer look at your legs, and can you show us your problem?
Yes, I have varicose veins down my leg. I've had them for the past 14 years.
Wow.
I first noticed them after the birth of my twin sons. I feel very self-conscious about showing my legs. I think that they're ugly, so I try to hide them.
And this is something that Anthony and I hear a lot from our respective patients, from women everywhere. And again, not just even women, but men. But when you're talking about after pregnancy, really what happens is the pregnant uterus puts a lot of pressure on the veins in our body, and our lower extremities in particular. They swell. And after you have your beautiful baby, or babies in your case, this is what we have, among other things, to show for it, right? So this is a pretty common situation.
Exactly. And just like you said, I mean, 20% of men and 40% of women have these varicose veins. And pregnancy is a big part of it, and that's why a lot of women have it. But there are other things as well. There are factors like genetics. If your mom has varicose veins, it's very likely you will too.
Either of you guys had it in your family?
Yes.
Mine too.
And then standing for long periods of time. Surgeons like you and I, we stand a long time. We're at high risk of it. Hairdressers too.
A lot of time on your feet, ladies?
Yes.
Okay, so we have everything. So but we're going to talk about what we can do to tackle the problems. What about prevention?
Well,
Let's
prevention, basically, these varicose veins are due to dysfunctional valves. So the blood doesn't move through the veins well, and we have actually a graphic we can show. You can see a normal vein, the blood moves through normally. With a varicose vein, the valves are dysfunctional, and the blood pools, causing it to look kind of thick and firm and too big. So prevention is the #1 key, and we have here some compression stockings. The first thing you can do is use stockings to help compress.
I love these. They actually have some pressure. They come in different weights, right?
Yep.
And people can get these in the drugstore or by prescription.
And if you've got a job where you're standing a lot, this is something definitely you can use to help prevent varicose veins and also treat them.
Okay, perfect.
In addition to just putting your legs up. Very important, put your legs up to try to rest your legs every so often during the day.
Should you have someone massage your legs when they're...
that's not bad.
Now, what about this?
Well, in the past, the only other treatment was surgery, and surgery was invasive. It created multiple scars on the legs. But we have an amazing new treatment now that uses a laser fiber like this one. And basically, you stick this, you insert it into a varicose vein. It will actually burn the vein closed as you slowly remove it.
Okay.
So it's called endovenous laser therapy. It is a revolution in varicose vein treatment today.
And curative, or does it need to be repeated?
Studies show 98% of the time it does cure the varicose veins because it literally destroys them. They're gone.
That's fantastic. And we should also mention, Anthony, this isn't just, I shouldn't say just, because I don't mean to trivialize the cosmetic aspect of it, but what are some dangers with varicose veins if they're not treated?
Well, varicose veins can cause pain, and so, have you noticed any discomfort?
I have pain, yes.
Yeah, so pain can happen, as well as in severe cases, even ulceration. So some people can get some serious medical complications from it, and insurances will sometimes pay for treatment of it.
And you want to go to a vascular surgeon or a plastic surgeon like yourself usually to do?
Yeah, there are a lot of vein specialists, typically vascular surgeons.
Okay, excellent. Now, Terry, as part of your swimsuit ready in 20 days, this is on your list, right? Because we want to help you deal with your spider veins. So I'm going to ask you to come over to the table for a second. And Anthony, you're going to show us a laser treatment for spider veins, right? And this does require us to put some protective goggles on. So everyone in the audience, I want you all to put your goggles on now. Okay.
So spider veins are different than varicose veins because varicose veins are kind of those puffy veins that we saw here. Now, spider veins are flat, and typically they're kind of these squiggly dark lines that look like the legs of a spider. In the past, we would treat these by injecting them with caustic substances that could cause pain and it was invasive. But today we have laser treatments, and this is the Candela Gentle Max, and it's gentle.
I'll hold your hand.
And with this laser, we can literally burn the vein away while leaving the rest of the skin intact, okay? So you ready?
You ready? Are you excited?
I'm ready. I'm so excited.
Okay, so we're going to see actually immediate changes with a laser like this.
What does that feel like?
It just is a little electric. It's not painful at all.
Yep, it's non-invasive. As you can see, she's tolerating it just fine. And it will literally cause the veins, the spider veins, to disappear before your eyes.
And how much would this typically cost?
It costs anywhere from $300 to $400 per treatment.
Okay.
Now, we usually recommend anywhere from 2 to 3 treatments for maximal effect.
And how does that compare to some of the other surgeries or treatments for vein? Kind of in the middle, or?
Well, it's definitely cheaper because, and the other treatments too, when you're literally injecting a needle into each one of these, you're injecting, once again, these caustic substances that could be potentially harmful. With the laser, it's literally just zapping these veins away.
How do you feel?
Oh, fine. It's great.
Well, it looks amazing. Can I get on the table next? So go ahead and sit up. I want you to see a before and after.
Oh, my gosh. Oh, my gosh.
And
That's
so you can
amazing.
already start to see that it really does go away almost
amazing.
immediately.
Amazing.
One step closer to your swimsuit challenge.
Yes, I can't wait.
Anthony, I really want to thank you again, Dr. Youn. And everyone in our audience is going home with Dr. Youn's new book, In Stitches. And we'll be right back with more tips to get you swimsuit ready.